Thank you so much. Uh, what I wanted to talk to you guys today about is really on the onset of COVID, and actually, if you even look back into 2019, in 2019 we added about 300 healthcare customers, and I'd say of those 300 healthcare customers, not a single one of them started with the same use case. Almost everybody did their own thing and started their own thing. But as we found when COVID hit, essentially there was a big push and a need for enterprise efficiency. So that allowed us to start creating better and more standard use cases and really separate from use cases and move into more of a persona thinking into automation. So what I'm going to cover over the next little less than 20 minutes is really that journey and some use cases around how you can transfer, how you essentially approach automation at an enterprise scale as opposed to just one use case at a time. So it's really talking about a fully automated enterprise. It's really around how do I make my employees more efficient in what they're doing and what they're accomplishing. And as I think about that, one of the things I looked at, and primarily what I'm going to be focused on today is in the provider sector, but I'll tell you that I have customers in life sciences. I have customers that are payers that are taking the same exact approach. And if you want to follow up with Ron, for those who are in attendance, to have a separate conversation about those industries, I'm sure Ron can put you guys in touch with me or anyone on our team. But essentially is really how to focus on my most costly employees to make them more efficient in their processes. And as COVID hit, essentially when hospitals, healthcare started opening back up, many of the CFOs that we were working with said, I can't bring all of these people back. I do not have a payment infrastructure to support the headcount anymore. And while, naturally we know that elective surgeries were postponed and those have picked back up and we're working through that backlog, but they've essentially said, no, we have to be more efficient. We have to do more with less. So one of the areas that we really focus on and really try to drive down into and create real content and real value in was in the clinical space. It was focusing on the clinical operations and all of the paperwork that's associated with essentially processing patients through the health system throughout their journey of care. And it even starts at creating a digital front door to when that patient leaves the office, to be able to walk out of that office and almost have an Uber experience where I pay my copay with Venmo and I don't have to stop and talk to anybody. It's really creating that patient experience that is both impactful to them and also impactful to the physician. Is like, how do I compress the amount of work and the physician fatigue that's within the EHR? So one of the ways that we really started looking at this, and I'll just bring up this slide. One of the areas that we focused on was incorporating AI as a component of automation. But even more so than that, it's creating AI combined with a human in the loop. And we have several use cases that we've done throughout the U.S. and throughout the globe as well, where essentially we are utilizing AI, whether that be in clinical NLP engines, whether that be in intelligent OCR to be able to read documents, whether that be in a machine learning algorithm that has the ability to process information. One of the big use cases that we have right now is in, of course, prior authorization. So how can we automate or fully automate the prior authorization process, both on the provider and the payer side? And if you think about that, the increase of that to increase, the increase or the ability to automate that essentially also impacts patient access, because I can get an answer for prior authorization in a matter of minutes as opposed to a matter of 72 hours or days. So where we look at the point of action is how to apply that AI, how to apply that component where, either a provider or an individual takes over versus the intelligent automation. So there are a lot of different areas that we can focus on with AI by, essentially appointment setting, research, electronic health record as a reliable risk predictor. And that's actually one of the first use cases that we're going to get into. So this is a use case that was actually sponsored by Centene, and it was a health system based out of St. Louis. What they had is Centene had a program that they were sponsoring to essentially detect early detection of pregnancy risk. And in the end, or the process that it essentially started as, is that the provider would recognize that there may be issues, or that patient may be a candidate for this program. They would fill out in paperwork across all of the information. They would fax that in to the system. That data was then manually entered into the system that had the machine learning algorithm on it, in which the outcome of that said, yes, this patient is a candidate. Please enroll them. Well, that process took about 15 days, anywhere up to a month to happen. So what we did is that we inserted automation and AI into that process, essentially utilizing the robot that the physician can kick off and says, I want to enroll this patient into the program. The robot actually goes through the EHR, collects all of the data that it needs, creates that into an Excel file that then transmits that data securely to the machine learning algorithm. And the algorithm runs against it and provides back either a yes or no to the robot. And then the robot then at that point says yes, updates the clinical record in the EHR, and then can follow up and actually even schedule that patient for further views. They ended up saving about $11 million a year. So it's pretty exciting. So this is another use case, and I think I'm going to come in on time. So this is another use case. It's a healthcare based up in New York. And so Chris has got me thinking about North Carolina. So this is a customer up in New York. And essentially what they were doing is they were having to redact all the documents. We essentially used an intelligent OCR engine along with a clinical NLP engine to identify the data within the forms that were going out, and automatically redacted all those documents that were going out for payment, for support on payment. Saved the nurses that were doing that just a tremendous amount of effort because, hey, that's what automation is for, is to relieve these very valuable, very costly assets that we have so they can do more meaningful work. So I've got like 3 more slides, and then I should be finishing up right on time. But one of our health systems, and we've had several go about this route, essentially what they're doing is they're taking it's essentially a robot for every person. And the reason for that is that if my employees can be more efficient in their day and in their processes that they do, they are going to be able to move patients through. We'll be able to bill faster. We'll be able to operate at a higher level. And essentially, if you look at this slide, the healthcare IDN that we're talking about, they started in revenue cycle management like everybody on the earth does. They started revenue cycle management because it's super easy. I can get some big wins and actually use that to fund some of the other processes. They then went to a robot for every person within revenue cycle management, and then to a robot for every person in the clinical setting. And we're going to have just fantastic use cases within there. One of the first use cases that we're starting is automating the discharge process. I was in a hospital not a year or 2 ago with my dad, and the discharge process took us 6 hours. 6 hours from when we were notified to when we were able to get out the door. Our goal was, and inside that process are literally thousands of microprocesses, of which can be automated. So this is a kind of a heat map of what that looks like. It was done with one of our partners, Guidehouse. We did a working session, and we're in the process of implementing these and really picking out, okay, we can automate this here, we can automate this here. But the ability for a physician to have a digital assistant on his desktop that can compress that workload is really what makes this possible. And I'm going to show you an example of how that would come to fruition. Actually, it was in, we have a gastro health customer. This is one of our partners, Camp Tech, who recently implemented this solution. And essentially what we wanted to do was, once again, create a navigational compression around the work within the EHR. And this was to optimize the pathology letters that were going out, and they had to do it on a daily basis. The number of clicks and the difference around that, we reduced it from 50 clicks to 5 clicks within this process to generate the letter that the physician was required to do on every output. We also had another use case at California Correctional Health System, where essentially orders were having to be deduplicated within 2 instances of Cerner. I did a video on this, and in that process, we were able to show that essentially we were saving the physician, the provider, 2 to 3 hours a day of data entry, of them actually having to recreate an order, in this case for an opiate, when a patient transferred between facilities.